So this is a CT scan, and can you detect the abnormality here? This is a reconstructed 3D CT scan of a patient who underwent a lumbar fusion a few years ago. He did relatively well for the first 6 months, and then he developed the pain again. And because he kept having pain, we ordered the CT scan, and here we can tell that the fusion was at the L4-5 level, and this is the sagittal view, and this is the axial view, which is basically a slice cut through the fusion mass. You can see the pedicle screws were placed within the pedicles appropriately, and we can go through the different slices here and look at the trajectory of the screws at the L4-5 level here, and they look pretty nicely placed. And then we can go through the L5 level as well, and we can see that those screws were also placed appropriately. We can see the horseshoe intervertebral device, which is also the cage, and the cage is also sitting right in the center of the disc. These are the 3D reconstruction images, and unfortunately the radiologist did not pick up on this obvious problem. Here we can see that the rod is actually broken. It's very subtle, but you can see that on one side the rod between these two screws are going through just nicely. But in this view, on the other side, this rod is actually broken. This is another reconstruction view of the implants, and we can see the pedicle screws placed appropriately. But again, this broken rod is obviously seen here. Options for treatment is to now approach the spine from the front, place more bone graft, and try to fuse the bone in the front. Or the other option is to go from the back, remove the screws, and just place some bone graft with the hope that the fusion will then take place. The third option is to go and place bigger screws, more bone graft, with the hope that this will eventually fuse. The patient is unfortunately a smoker, so he still has a higher risk for development of pseudoarthrosis and this not fusing. Probably the best option is to go from the front of the spine and try to put more bone in the front. We'll keep you posted on the next upload.